Hi guys, welcome back to my channel. I'm talking quite quietly because it's about 25 to 1 in the morning. I am currently right in the shit kicker of a flare-up. So I'm not sleeping, probably won't sleep till about 5:45. I'm in tracksuit with hot water bottle. This is the standard flare-up situation. Anyway, I decided to do this because in the last video that I did about my Crohn's, it was sort of just letting you guys know that I had it and how I got it. Not really a lot on what's going on with me now and the treatment that's going on with me now. And even if I did touch on anything back then, a lot has changed in terms of treatment and, you know, surgery being in the frame, surgery that I don't really want, but that's that. And it got to the point where I just thought, you know what, I'm going to be so matter of fact about this disease on my channel, not even going to miss out any gory bits. I've had so many people, like with Crohn's, message me and speak to me and rant, not at me, but towards me about the disease, saying like, you know, it's just bullshit because, excuse me swearing, because they're sick of people saying stuff like, let me read you a rant that I got off somebody. It's really difficult. I'm struggling to explain to work at the moment why I can't travel an hour and a half every day and they just don't get it. No one fucking gets it. And if one more person asks me if it's IBS, I'm gonna cut a bitch. And if one more person tells me to just take Emoji and be done, they're getting it too. And while I'm ranting, if one more fucking person asks me if it's in my head or if I'm just being overdramatic, they're gonna bloody get it too. Why does no one understand? Now, these messages are really sad to get, and I actually do get quite a lot, because what I've noticed in the sort of Crohn's and colitis community is people get close real quick because we have to talk about, you know, personal things real quick. It is difficult and it is annoying when people say stuff like, oh, I heard if you eat lettuce you can be like cured. Like, no, it's an incurable disease. Incurable. It's chronic. There is currently like a multi-million-pound charity trying to find a bloody cure. Like, lettuce is just not going to fix me. Do you know what I mean? So the way I see it is people only say stuff not even from a negative point of view, just because they're so unaware about, you know, the disease itself. The whole purpose of this video is hopefully to teach you guys a little bit about the different treatments, how they work for us, the dangers of us, and where my next step is in terms of if this last treatment doesn't work and surgery and things, so you can maybe understand a little bit more. My camera is on 10%, so I'm actually really brave filming this video because I'm going to be like, quick fire, do you know what I mean? It's gonna be quick fire, which is probably what you guys like because I talk for England. So I'm a little bit sad because I did tell you guys that I was on 8 steroids a day, and I was, and they tried to wean me off. They tried to wean me down off a steroid a week, so it went from 8 to 7 to 6, so forth, and I got to about 4 or 3. It just came back, flared right up, and it was horrible. There was a lot of pain and a lot of blood, and it wasn't very nice. It was horrible for me. So sadly, they've put me back up on my steroids, which isn't good because it gives me moon face. And I don't like not sleeping. Not sleeping isn't nice. So that's why I'm quite sad at the minute. I really was like willing my body to be ready, but it wasn't. I'm basically rattling, like tip me upside down, it's like a Tic Tac box. So basically now I am on another treatment called azathioprine. I take some in the morning with my morning medication, and I also take some in the evening. I have to do this because it makes me have really blurred vision and feel really quite dizzy. So I have to sort of like, whoa, for about 30 minutes after, because I just know there's not a chance I can do much. Like, it knocks my vision to 100. What azathioprine is sorry, I'm nervous again. I get so nervous filming about this, and I want to keep filming about it because it's not something I should be nervous about. So you have to bear with me, okay? Immunosuppressant. Boom, said it. What it does is it holds back your immune system, because my disease is my immune system attacking itself and hurting itself. It's holding back my immune system, so it's giving my intestine like a chance to be like, dude, let me breathe, thank you, let me just heal a bit, like get a bit of air, do you know what I mean? So I think it'd make a bit more sense if I kind of explain to you what's going on in my bowels and the way it looks. Cute. I'm going to draw you a diagram. I took GCSE and A-level art, so it's about to get real. So here's my butthole. My small intestine leading round into my big intestine. Big smile. Lashes for days. And crazy curly hair. Like, you guys have seen my curls on the gram. And some titties. Okay, one's bigger than the other. And Okay, this diagram is getting really dramatic. So, this is me. This area here, where my large intestine and small intestine meet, that is my damaged area. And because, as I said, they didn't catch it for about 2 years, it has spread. So I have 20 centimetres of diseased intestine, which is just so cute. If you were to look at my intestine sort of from this angle, this is what it would look like. So a healthy colon looks like this, with a wall of about 2 millimetres and a gap of about 4 centimetres of food to get through. And then mine looks like that. So mine has developed a wall of 10 millimetres through the abscesses and ulcers, with a gap of about 1 to 2 centimetres for food to pass through. So that is why after I eat, I'm in really bad pain. Anyone who's eaten with me, so my friends, my family, will know after I eat a meal, I have to go and lie down and I'll have a hot water bottle and I'll be in pain, hence. Because as soon as it gets through that gap of the large intestine, it is trying to cram through like a hole that big, a whole, I don't know, pie and mash, or like sausages and mash, or like spaghetti bolognese through a hole that big, and it's just hurting. And as it's doing that, excuse the, as it's doing that, I've lost my train of thought now because I'm just so childish. As it's doing that, I can't not do it. It's rubbing against the ulcers and abscesses and bursting them. So if I eat too much or I do too much, then they burst and they bleed. So that's not nice at all for me. So what the azathioprine does is it holds back the immune system, like I say. The danger of this is it's holding back my immune system. So my immune system is like low. So if you cough or sneeze near me, I'm gone. I'm running. You're not seeing me again. A common cold passed about for me can make me seriously ill. My friend Tegan was going to come over the other day. She has a little cold. I was like, babes, like, she was like, I can't come over, Georgina, because I don't want you to get poorly. Like, you're also at high risk of lymphoma cancer, melanoma cancer, all of that stuff, but let's not even go there. I don't even want that thought in my head, really. Now, this treatment, it works. It's great. It's the first go-to treatment for Crohn's, and it's great, and people love it, and people stick with it, and they go into something called remission. Remission is what I dream to be in. I can't wait. I hope the day comes soon. I don't want it to be ages. I just want it to come, because once you're in remission, I can live a normal, healthy life. I can eat things Georgina loves to eat. I can do things Georgina used to be able to do, hopefully. But because I'm Georgina Elliott, it's not worked for me. I was really sad about it, I was really down about it. I've had my cry for a week or so. I got quite depressed with it, and now I'm sweet. On to the next treatment, what's next? So I went to my gastroenterologist, and this was the discussion that we had. Azathioprine, if that doesn't work, biologics. If they don't work, you'll be having the surgery. So now I'm sad because it's like, so I'm kind of on my last bit of treatment that I can try before I have to have this surgery. So anyway, this last bit of treatment that I'm trying next week, which you will be doing with me, because I've decided that I'm going to vlog this process because there's not a lot about this treatment on the YouTube kind of thing, and if it is, it's not very matter of fact in a sense of like walking through it with other people. So anyway, this treatment that I'm going to be on, a different type of biologics, and the biologic that I've gone for is something called Humira, however you want to say it, potato. Anyway, this treatment is, how do I explain it? Syringe, needle. I'll be injecting myself, basically, long story short. This treatment is a cellular treatment, so it's not chemical like paracetamol or something, it's cellular. Now the danger with cellular treatments is your body can create something called antibodies. So imagine, for example, chickenpox. You get chickenpox, your body creates something called antibodies, which are like cells that are like, no bitch, like I did not make these cells, these have come in here, you don't belong here, go. And then you don't get chickenpox again. So the thing is with these biologics is my body over time can create something called antibodies. That would then mean my treatment doesn't work and I can't ever use it again because my body's created antibodies. So I'm praying, and everyone who's watching this, please pray for me and hope for me and cross all your fingers and your eyes and your nose and your moustache hairs and everything for me that I don't create antibodies. The risks of it again are cancers, not as high though, I can't speak. Also it holds back my immune system as well, but that's nothing new. I've had to have pneumonia jabs, flu jabs, and they took that life out of me because obviously I don't have an immune system, and they put a little bit of whatever they're giving you a jab for in your body, so that knocked me out. When I had my pneumonia one, I was in bed for like 72 hours aching. I've had, you know, hepatitis blood test, TB chest scans and blood tests, quantiferin blood tests, everything that you have to have before you start this treatment, just to make sure you're good to go. I'll be monitoring whether I have antibodies or not, you know, every sort of month or so through blood tests and scans and things like that. That's how they monitor it. There are currently 2 other treatments that have just come out though that I could try, but they haven't really got much back in them because they're so new. Oh God, I forgot my train of thought. Oh, brain fog, I keep getting brain fog. Vedolizumab, don't watch me, sorry, learning the terms and that. And then there's one that came out in July a couple of months ago called I'm going to struggle with this one. Ucticinumab. I'm probably butchering that and saying it wrong. Yeah, neither of them have really got a lot to go on, so they haven't been discussed as an option yet for me. So for me right now, they're going to use azathioprine and run biologics alongside it. Why am I being so dramatic with my hands? Yeah, that's what they're going to do. So hopefully that will work. It targets something called TNF. Now TNF is what causes my joint pain, causes me struggle to walk and the stairs and things like that. I have days like that, I've said that already. And my joints hurt all the time, like I'm like an old woman, and hopefully this will target that because it's the TNF that's causing the joint pain. So everything crossed again, guys, that this works for me, please. My gastroenterology team will send me a big box, cool box thing full of all my needles. I will get 16 weeks worth and a special box, a sharps box, you know, like what you have in science at school, where you put your things in, but you can't get in it, but your needles can go inside it, but you can't get them back out. And then like starter kits and calendars and how it all works. And then the company called Healthcare at Home will get in contact with me and call me to make an arrangement. And a nurse will come over to the house and she will teach me how to inject myself and deal with the needles after and all that sort of stuff. I start off at a loading dose of 160 ml. Now I know that in each needle alone there is 40 ml, so I have to use 4 needles at once, but we'll find that all out. But I'm going to be vlogging that whole process because I want you guys to come with me and understand the struggles that come with this, because it could go really well, it could not, and I want to share it with you guys. Because I think it's important. If I'm going to actually share my whole Crohn's story, then I'm going to share the whole thing, not just the positive good days when I'm doing chats like this, because there are days when I'm sat on the toilet floor, you know, doubled over. I think everyone's best going to learn about this invisible illness and this invisible disease, because I do look fine. I'm still posting on Instagram fine. It doesn't affect the way I look because it is a disability. It's just an invisible one. That's what it's classed as, an invisible disability. And I think that's why people think, oh, well, you look fine, or you don't look sick. Babe, you should see my insides. But you'll see all of that. Like, I don't know a lot about it. I want to learn about it, but I want you guys to sort of learn with me, because there will be days when I do not want to inject myself, days where I don't want to inflict pain on myself because it hurts. Amy, my best friend, I will need my mum, I will need my brother or someone just to be like, look, here, stab it in me, done, so they can learn to do that as well with me. Basically, the next step after would be surgery. So what they would do, I don't want to talk about it too much because I feel like what you talk about is what you put in, like put out to the world, and I'm just really not, I'm scared. I'm really scared. Like, stop with the positivity, I'm really pooing myself. So what they would do is they would actually remove the 20 centimetres and stitch the large intestine and the new end back together. And it's not surgery that I want to have at 20, because the thing is with that is I have Crohn's, I've got it forever. So the downside to this surgery is, yes, they can remove the 20 centimetres, right? But it will come back and it will disease another 20 centimetres or another 40 centimetres, and they'll just have to remove that, and they'll sew it back together, and it will disease another bit, and they will sew it back together. So I said, like, doc, do you know what I mean? I said, what happens when you keep removing intestine and there's nothing left for you to remove? And he was like, that's when you'd have a colostomy bag forever. So I don't want to start that surgical process at the age of 20, 21. He said, please don't be surprised if you're going to need surgery sort of within the next year. It is in the frame, which I don't want to say because I don't want it. I'm going to get upset. So no, we're just going to move past this because it scares me, it keeps me up. We're going to try and find something that works for me so I can go into remission and it's all good. That is the goal. Positive, positive. Yeah, I'm trying so hard, guys, you have no idea. Anyway, I advise people to make this Crohn's log because family members and friends can look at it. I've got friends that sit and flick through it and learn things. My mum knows what I'm doing, what I'm taking, and it's just really good. And also it's for me, if something happens to me, or like I have a flare up, or I have a certain symptom, or I can remember a rash, I can be like, right, I took this on this day, I upped a dose on this day, I dropped down a dose on this day, this is when it happened, and I can take it into my own hands. Because the one thing I've realised is, the more I know about my disease, I don't know if you know, I'm trying to like look like a scientist in this video with all my like cellular, do you know what I mean? Excuse me, don't watch that, but anyway, the more I know about my disease, the better I feel about it, because I feel a bit more in control. Just information about my azathioprine, And shock, already an Excel spreadsheet. Anyone who knows me and has been on holiday with me, girls, boys, anyone will know I'm obsessed with Excel spreadsheets because I took the packing lists very seriously. So this has my azathioprine weeks and how often I take it, and then I have quite a few of these. I'm meant to take them everywhere with me. They're these sort of like blue cards with my prescription on, and they say please take these cards everywhere with you in case something happens to you or you have a funny term, blah 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 blah. It's got my address on it. These are my prescriptions, which I find hilarious because there was once a time when I go to the doctors, like all of you guys, and I get a little green prescription. Oh no, I have A4 prescriptions, guys. The next thing I've done is these sort of months. So you've got like August, September. So let's just look at September. I write all the medicine that I'm taking and colour code it and then the number. So for example, my prednisone steroids, they're purple. So I don't know, on this date I've written an 8 number purple. But I've written a purple number 8. So that means I'm taking 8 of the steroids. So I know exactly how much I'm taking of everything on each day. Really OCD and weird of me. I'm also tracking my sleep because I'm not sleeping and I want to know what tablets are keeping me up. So I have a dietitian at the hospital who I meet with, who's giving me sort of strict diet rules and stuff, things I can and can't eat. So this is my current diet thing. It's not what you expect. So people would think I have to eat fibrous fruit, veg, wholemeal, things to get things moving through my body. No, I have to avoid all of that. I can't eat anything wholemeal, white everything, white bread, white pasta, white potato, just everything white. I can eat potato, no skins. I can't eat peas, sweet corn, beans, broccoli, cauliflower, celery, cabbage, onions. Well, I do eat onions because they're in everything. I can't eat any fruit or veg with the skins or seeds on. Nothing like that. It's like really random. I have to basically eat crap. But anyway, I just wanted to update you guys on where I'm up to and let you know the process of what's going to happen. So the next Crohny sort of thing is going to be my vlog with my new treatment. So I'm not going to say things are looking up because I don't really know where things are looking. I ain't got a clue, I'm in the dark. Thank you for watching this video. It's not a fun, amazing makeup one like with Katie or a lovely one with Safia, but they will all be coming. But these ones also need to happen. So that is that. Sorry if it bored you, I hope it didn't. I hope you learned something. Stay tuned, like, comment, subscribe, all of that shebang. See you next week.